Hey everyone, welcome back to Anesthesia. I'm Dr. Daniel Medell, an anesthesiologist, and today we're diving into a gripping and heartbreaking human case study. It's the story of Dr. Donda West, educator, mother, and mentor, and the tragic series of events that led to her untimely death. Now, this isn't going to be tabloid gossip. We're going to stick to the verified facts, the medical findings, and the lessons that we, as medical professionals and as patients, can learn from her story. I'll walk you through exactly what happened, why it happened, and how it changed the law in California. And as an anesthesiologist, I'll also give you my perspective on what might have made the difference. Let's get started. Before we talk about the events of that day, we need to understand who Donda West was. She wasn't just Kanye's mother, she was a powerhouse in her own right. She served as the chair of the English department at Chicago State University for 24 years, mentoring countless students and founding the Gwendolyn Brooks Center for Black Literature and Creative Writing there as well. She also worked closely with Kanye as his manager and as CEO of West Brands LLC, helping to shape his career from the ground up. She was deeply loved by her son, by her students, and by her community. She inspired Kanye's music in a very direct way. If you've ever listened to his song Only One, or the album Donda, you've heard that connection. So when she passed away suddenly, it wasn't just a personal loss for Kanye, it was something the public felt. People saw her as the guiding force in his life, the one person who kept him grounded. Her death was shocking, and it made people start asking some really hard questions about medical safety. On November 9, 2007, Dr. West went in for a series of cosmetic procedures in Los Angeles. The plan included a breast reduction, tummy tuck, and liposuction all in the same surgical session. Now, this is important to understand. These are significant procedures, each with their own recovery demands. When you combine them, you increase surgical time, anesthesia time, overall blood loss, and stress on the body. For a patient over the age of 50, those risks are even greater, especially if they have any underlying health conditions. The surgery lasted about 5.5 hours, and here's the part that raised a lot of eyebrows. Instead of staying in a facility overnight for monitoring, she reportedly went home soon after the operation. From an anesthesia and patient safety perspective, that's a huge concern. The hours right after surgery are often the most dangerous. It's when blood clots can form, when breathing problems can begin to manifest, and when the effects of anesthesia and pain medicine are still in play. In a hospital, we're there to catch those complications early. At home, you just don't have that safety net. So what actually caused her death? The Los Angeles County Coroner's Office investigated, and their findings are very telling. The autopsy revealed that Donda West had significant coronary artery disease, meaning that 2 of the major blood vessels supplying her heart were narrowed by about 50 to 70%. That alone increases the risk of complications during and after surgery, but that wasn't the only factor. She also suffered from aspiration, which is when stomach contents enter the lungs. This can happen if a patient vomits and isn't fully able to protect their airway by coughing or spitting up. Aspiration can cause a pretty severe kind of pneumonia, which can impair your breathing and your lungs' ability to absorb oxygen. And unfortunately, she did have evidence of bronchopneumonia on autopsy. On top of that, her torso was tightly bandaged after surgery, which can make it even harder to take full breaths. Combine that with pain medication, which can slow down your breathing, and you have a really dangerous recipe for some critically low oxygen levels. The coroner concluded that her death was due to pre-existing heart disease combined with these multiple post-operative factors. Importantly, they also found no evidence that the surgery itself was botched or that anesthesia was mismanaged during the procedure. The danger came from what happened afterward. When this case hit the news, medical experts across the country weighed in. Dr. Mark Mandel Brown, a well-known cosmetic surgeon in Cincinnati, Ohio, pointed out that long combined surgical procedures significantly increase risks of things like pulmonary embolism, blood clots that travel to the lungs, and cardiac events like heart attacks and arrhythmias. Dr. Stephen Hopping, president of the American Academy of Cosmetic Surgery at the time, stressed the importance of thorough preoperative evaluation, especially in patients with known or suspected heart problems. He also stated that sometimes the safest choice is to stage procedures, do them in separate sessions instead of all at once. From an anesthesiologist's perspective, there's also the issue of patient advocacy. If a patient is high risk, like someone with significant coronary artery disease, it's our job to raise the alarm, to say, hold on, this isn't safe. Let's get cardiology involved. Let's optimize this patient before we go forward. A report by a coroner's investigator wasn't able to determine whether that happened or not. Donda West's death didn't just lead to grief, it led to change. In 2009, California passed what's known as the Donda West law. This law requires all patients to have a physical exam and medical clearance from a licensed physician before undergoing elective medical surgery. It might sound like common sense, and in many places it is standard practice, but at the time it wasn't legally required in California. That meant some patients could go straight into surgery without anyone doing a thorough check of their heart or lungs or determining if they had any other health risk factors. It's tragic that it often takes a high-profile loss to create meaningful change. But this law made California one of the states with stronger patient protections in the cosmetic surgery field. And for anesthesiologists, it reinforced the importance of pushing for those medical clearances before the first incision's ever made. When we look at the big picture, there are a few clear lessons from this tragedy. First, pre-existing health problems like coronary artery disease can turn an elective surgery into a high-risk event. Second, combining multiple major procedures into one long session increases surgical stress and the risk of serious complications. Third, immediate post-op monitoring is critical, especially in the first 24 hours. Skipping that step removes a major safety net. And fourth, her story reminds us that laws and protocols exist for a reason. The Donda West law is a safeguard that might have already saved other patients from a similar fate. Thanks for watching this deep dive into the medical facts and lessons from Dr. Donda West's passing. If you found this informative, please hit that like button, subscribe, and turn on notifications so you don't miss future videos. And let me know in the comments what other medical investigations you'd like me to cover. Thanks again, and I'll see you next time.